Good morning, good afternoon, everyone. Thank you for joining. As more participants are joining, we should wait a minute or so before we start. As more and more participants are joining, uh, we will start briefly with the housekeeping rules before we really start the content. But once again, thank you very much today for joining the fourth of the sixth webinar series on Steps Towards Safely Managed Sanitation webinar. Today's topic is Scaling Sustainable Rural Sanitation, Systems That Last, Behaviors That Stick. I'm the host of today's webinar. My name is Maya Igarashi Wood, Sanitation Lead at WaterAid UK. So before we start, quickly some housekeeping rules for this quick 60 minutes webinar. Please turn off your microphone and the camera while you are listening to other speakers presenting. And use the chat for question and then comments as actively as you like, so that we can have that conversation discussion during this brief seminar. And then also, if there are any questions that we cannot address, we will later address those by email. If you have any technical issues, please feel free to ask assistance in the chat. Our team will respond to you. This webinar, like all the others so far, will be recorded, and the recording and the slides will be shared with everybody who participated and then shared in the Susanna website. So without further ado, it's great to see more than 60 people joining. Feel free to already introduce yourself, your name, your organization, where you work in the chat. Today's session, after myself speaking and share the opening and the background, we have my colleague Abdul Nashiru Mohammed, Regional Director, West Africa of WaterAid. We will set the scene on the current progress at the global level on the rural sanitation sector, with challenges that we still face and the shifts we must make. Then we have two distinguished guests from Cambodia and Mali who will be sharing their practical example on this ambitious journey toward safely managed sanitation for all in rural settings. We will close the session with the closing remarks from Martina Rama from UNICEF West and Central Africa Regional Office. Before we start, we have for this morning session, there is an interpretation option between English and French. So please choose your preferred language option with the globe icon at the bottom of your screen, and so that you can listen to your preferred language setting and also interact. So, as a start, this webinar series follows the first Global Sanitation Summit held in Nepal last June, co-hosted by UNICEF, WHO, and WaterAid with support from other sector partners. Delegations from over 20 countries shared their progress toward SDG 6.2, along with their unique challenges and insights. While the summit was rich in learning, the only those presented at the summit benefited directly these exchanges. You can get insights from the session videos on the screen, or the Bible of how it was. But we wish to keep this momentum going and widen that circle of peer learning in the community. That is why we launched this global webinar series to open up peer learning across the sector. And that's why we are here for the fourth of the 6th webinar series. You may ask why this steps to safely manage sanitation approach. If you have joined previous sessions, this is just a refresh. But for those who are first time joining this webinar series, just to give you a little bit of background, we all recognize the urgent need to accelerate progress. For that, we must create better alignment and coordination among the sector actors. We also need a clear understanding of what safely managed sanitation and also climate resilient sanitation really means in practice. So this STEP framework isn't new, but it is a practical checklist to help us navigate existing guidelines and tools. Each step includes key questions to help identify gaps, set priorities, and support government-led strategies, whether at a national or subnational level. For example, today's topic is about the step 6 of this slide, focused on local service delivery. So we may ask, are there costed plans at the subnational level with clear targets and timelines? Are users, particularly marginalized groups, and service providers all involved in the planning and the monitoring of service delivery? So this step-by-step approach helps bring clarity and coordination as we work towards SDG 6.2 targets. So with that background, I'd like to pass the mic to Nash, Regional Director West Africa of WaterAid, sorry, to share the current trend and the progress within the rural sanitation sector, as well as the challenges and the shifts that we must make in order to accelerate our progress. Over to you.
Thank you very much, and welcome to this session. Good morning, good afternoon, good evening, depending on where you are based. As has been mentioned, my name is Mohamed Abdul Nashir. I think in the wash sector, I'm very well known as Nash, presently based in Accra, Ghana, the Regional Director for WaterAid in the West Africa region. So some of the things that I'm going to highlight are probably already known to practically everyone, but at the end of each step, I will try and emphasize a couple of things so that they can inform the conversations going forward. So the question has been, and will probably continue to be for quite a long time, it's, why rural sanitation still matters. Again, so turn it a bit, does rural sanitation still matter? Absolutely. And the facts are really clear that to date, we still have just under half of the rural population having access to safely managed sanitation. And here we're looking at rural. 2 out of 3 people live without access to basic sanitation, and these are found in the rural areas. We also know that 9 out of 10 people still practice open defecation, and you'd find some of them in the rural areas, and clearly limited sustainability of ODF. And just to emphasize here, GMP has made it very clear that progress on ODF is remarkable. It is good in some sense. But if you analyze that further, you'd see that the pace at which we're making the progress is too low for us to be able to achieve the ambitions we have for reaching SDG 6.2. Sustainability, as has been indicated, remains another major challenge. One, we have issues of slippage after certification. 2, we have a cycle of rebuilding of toilets simply because climate change has affected a lot of things in the communities, so people build toilets, and when the rains come, they just wash away those toilets, and then they have to go into building again. So a whole cycle of rebuilding, that if you look at somebody in an urban area with a WC, a water closet, who buys it for just once and uses that for, say, the next 5-10 years. But those in the rural areas continue to build and invest their meager resources into this. And last but not the least, the challenge around waste management. Again, emphasizing how important it is for us to look at excreta management. Next slide, please. And now going into some of the deep challenges. Again, as I mentioned, these are not new to many here. Lack of harmonized approaches is a big issue. You have this institution doing its own thing. You have another institution just in a neighboring community doing its own thing, and they're not coordinated. A big challenge for the sanitation sector. We also see a lot of short-term focus on eliminating open defecation. We know how important it is to eliminate open defecation, but a short-terminist approach is becoming a very big challenge, like project ties, and once the project ends, everybody packs up their baggage and they leave. A big challenge that we're looking at. The third is around the low political commitment. And we've said this over and over again, and sometimes how we campaign and advocate and influence for increased prioritization of sanitation. But we ask ourselves, when they say, yes, we have prioritized sanitation, do they allocate corresponding resources to implementing those sanitation commitments? And the answer has always been no. And best case scenarios will say somehow. So how do we change that? The fourth key area is around limited innovation and then inclusive solutions. So just underlining inclusion here. Do we build or design with the aged in mind, with women in mind, with children in mind, with persons with disability in mind? Sometimes no. We have a certain standard and we try to roll out that standard irrespective of the context. So another major challenge. And then we have capacity and resource limitation, especially for subnational level. For some of you, it would be maybe a province, it would be a district or a sub-district or an area council, whatever it is. Subnational level capacity remains a major challenge. And last but not the least is insufficient data to support decision making, to support, call it proactive planning or context-related planning, among others, monitoring progress. So again, let me just emphasize a couple of things here in terms of those challenges. One is when we continue to act separately and in an uncoordinated manner, unintentionally, some would say intentionally, we leave out certain populations. We just leave them behind. So once your targeting is such that you leave some people behind, how do you then say you have achieved total sanitation for an entire community, a district, an area council, a parish, a province, and so on? The second thing I want to emphasize that if we are looking for long-term improved health outcomes, we need to go beyond those short-termistic approaches. We need to look at long-term excreta management, among others. And then last but not the least is when we say sanitation is a priority, how do we ensure that the required resources or corresponding resources are allocated? Now, just making a shift to what we really want to see. ODF is very important because it helps us in terms of creating demand and so on. But we're looking at how we move from ODF to safely managed sanitation. So again, not underestimating the importance of achieving ODF. It is really important. It's an important, critical step, but we need to go beyond that and target safely managed sanitation as our ambition. So we have a number of practices that would need to change. So how do we make sure that we're looking at total hygienic toilet use? So not looking at where you build a certain thing and it's not even safe to go in and so on. How do we ensure that we're looking at safe containment, treatment, and safe disposal? We want to make sure that the designs we put forward are inclusive. They were looking at climate resilience, and last but not the least, we're looking at service delivery. just to make sure that the services continue to run, so service-based. And just allow me to emphasize here again. So yes, ODF is critical, but it is not the end goal. Demand creation is very important. Change in practice or behavior are really important, but safely managed sanitation is the ambition, the global ambition we want to achieve. Really important, and it's really about safely managed sanitation for all, not for some. So really important to highlight that. Again, we want to look beyond access to toilets to focus on all the things that I mentioned. So it is possible, so people ask, so is it really, really possible for us to be able to achieve safely managed sanitation? And this is just a typical example. There are many more examples that I believe some of you have already experienced and can share. So this is a case of Thailand, where in a space of, say, 2 years, they had 2 prime ministers chairing their national sanitation conferences. So sort of giving it that high level profile. In about 20 years, they managed to end latrine subsidy and rather deployed a revolving loan scheme, where households are able to finance their own sanitation, leverage some more to be able to invest in sanitation access, among others. And then over the last 10 years, 10 years later, that we had the lead ministries, so 2 key ministries, passing an ordinance for all homes in the country to have sanitary toilets before registration. In some countries, I think even Ghana, you have like a building code and so on, but you still find houses without toilets, or they include the toilets in the designs, but when it comes to actually completing the house, they convert those toilets into rooms and rent them out. So how do we make sure that we learn, that we have a government leadership, that we also aim to go at scale? So 20 years of sustained public funding going to scale, household investment is improving a lot of health indicators in the country. Many more examples that we could look at. Next slide, please. And now going to what a lot of us are really looking forward to. It's really about area-wide sanitation. So 4 critical factors to consider, as you can see mapped out here. This is about going to scale. So sanitation service provision is clearly coordinated and implemented at an administrative level. And I've mentioned earlier on that administrative level could be a district. For some, it could be an area council or a subnational or a parish or a province and so on. But that administrative level, a wider scale beyond community. So emphasizing here beyond community. So how do we work in an aggregated way that when all is said and done, we have a whole administrative area becoming ODF. So universal access, so that is another aim. It aims at achieving universal access by identifying the various needs of the different populations, especially the marginalized and those who are high risk, so to make sure that we target them. Like I indicated earlier on, could be women, could be children, it could be the aged, could also be persons with disability, that we have them at the back of every design that we put forward. Otherwise, we'll be leaving a lot of populations behind. Government leadership, we've already talked about, so for me not to belabor this, but it's really critical for government to create that enabling environment, for this to thrive. So how do we make sure that the policies are there? How do we ensure that somebody is taking accountability for coordinating the various actors operating in that space, and that we are monitoring and the systems for tracking are available at national and subnational level. And last but not the least, it's about sustainability. Safe fecal management is really important. And in rural areas, we know that there are major challenges around those, and we need to make sure that we try and deal with. So this is a model that was put forward by USAID Wash Parks. Now, some of the shifts we want to look at. So 3 important shifts. So how do we shift from project-based approaches to a system strengthening approach? So with system strengthening approach, we're looking at the various policies being available, regulation is top-notch, finances are available, there is sufficient capacity, and the environment required for this to work is also in place. The second is around shifting from short-term behavior change activities or campaigns to an embedded norms approach. So you roll out a campaign, it is great, you get attention, but then policy makers don't draw that into large-scale, say, health sanitation programs. So how do you make sure that these are embedded for long-term, rooted in local institutions? And we have what we call indigenous knowledge, knowing what works in a particular context and building those behavior changes into their norms and practices. And then last but not the least is around infrastructure. How do we go beyond infrastructure to designing for everyone? Last slide. And here we're looking at the role of the local government. Without any doubt at all, clear mandate is required. 2, financial resources to match this ambition that we're setting for them. And 3, technical capacity, technical support, could be from national, could be from allied institutions. And last but not the least is really around coordination. So again, to sign off, let me just emphasize one thing, that local governments need to be empowered without strings attached. 2, that they have to be resourced without central government control or determination of how they use those resources. And last but not the least, the resources should flow in a timely manner without leakages. Thank you very much.
Thank you very much, Nash, for really concise but very important presentation on the key issues, but also how as a sector we need to move forward. So here, as we transition to really listen to actually how that's done at the subnational level in different countries, this is just a reminder for why we are here for this session. You've heard just now about that what system-based approach to rural sanitation looks like and how it could be applied in actual different contexts. And then we are going to explore real-world examples of how these systems, supply chains, and a behavior change, demand creation come together to advance our service delivery of sanitation in rural settings. So as you listen to the presentations, please think about in your context, what system elements are shown in your context of intervention and your countries? Where are the gaps? How can we work together as a sector partners group to accelerate safely managed, sustainable, inclusive, climate resilient sanitation in rural settings? So with that, I would like to introduce the first country case study of today's morning session. We are delighted to have Mr. Dina Cheng, first Kandao District Governor of Royal Government of Cambodia. So, Mr. Dina, we'd really like to hear your leadership and how in your district your efforts to advance this issue around sanitation toward achieving safely managed sanitation for all. Over to you, Mr. Dina.
So, good afternoon, everyone, and it could be good morning because the time is different. And thanks for having me here. And I am Dina Cheng, or Cheng Dina, the district governor of Sakana district in Cambodia. And big thanks to WaterAid for providing me the opportunity for showing what we have done here in the district. And we look at the overall of Cambodia situation for sanitation. Almost everyone in Cambodia, we can say 90% has toilet, but not all of them are good enough to be considered as safely managed. And for about the climate, now we are seeing more flood, and the effect of climate change are getting worse because in our country, sometimes it is the rainy season, but there is no rain. And for sometimes there is rain, the hot season, but there is still rain. So it changed a lot. So we have to cope with it. For the SMS progress, currently different part of government are working together to make sanitation better across the country. They've been trying to agree on how to measure progress since a meeting in May 2023 and now in 2025 now. And we have seen a lot of progress here in Cambodia. For the ODF area, the Ministry of Rural Development is working hard to make more province to achieve the ODS. And now we have 26 province, and there are 18 that achieve the ODS, and there are 2 among them that they get the ODS plus in Phnom Penh and Kanal province. And beyond the ODF, now the focus is not just only having any toilet, but for better toilet and also making sure everyone have clean water and good hygiene in their home, school, healthcare center. This is called universal WAS. Dealing with climate change, when planning or for safety manage sanitation, we are also thinking about how to make this system stronger so that we can handle things like flood and other change in climate. Please, slide number 3. So what the district did to achieve this goal? Here are what we focus on for safe sanitation for everyone. For creating detailed budget and plan, we didn't just have idea. We make detailed plan for making sure everyone has good water, toilets, hygiene. This plan also show how much everything would cost. We know how to use their monies wisely. As we know that we have to plan, because if we don't plan, we cannot use our money correctly. And also our money or budget is very shortage, so we have to use it properly. Assessing strength and weaknesses. We conducted an assessment of all different parts of our WAS system. This helped us to understand what was working well and where we needed to improve to achieve safe sanitation for everyone. We look at things like infrastructure, management, financing, and skill that people involved. Next slide, please. They are the key progress of achievement of my district. Our district was reached ODF plus in 2004. This means we don't just stop at everyone using toilet. We also working on safety managed WAS, making sure people can wash their hands, promoting good hygiene. This so we are really leading the way. What helped us succeed? They are the main thing that make our progress. For sure, strong leadership. It means the commitment. As the district governor, because we have 3 people in our head to lead the district. We strongly commit to this activity. We also include the activity in our 5-year plan, 3-year plan, and 1-year plan. And also we included in the commute also plan. good planning and monitoring, of course, for sure. If we don't plan, we cannot do it. And we have to monitoring and we find the something that is not working, we have to work it. Having what we needed, resources, gender inclusive. Resource mobilization, we work hard to raise money within our own district. More than 40% of what we needed. This money was used to help poorer people or poorer family build twin pipe toilet. These pipe toilet are a good choice because they are last long and affordable for the price. Here are the different source of funding to help poorer family. One is partner. Of course, WaterAid is the big donors or the big partner with us, and they help us from the scratch. For the first time, we don't even know what ODS mean, and even the data, we cannot know, we don't know how many people using the toilet and are not using the toilet. So partnership is very important. And the second one is district is ourselves. We have, if we want to achieve something, if we want somebody to help us, we have to help ourselves first. And community also play an important role in this achievement. And household for 11%, mention is 7%, in village is 5%. So here are the people that help us achieve our goal. Another thing is thinking about everyone, men and women in all our work. We don't just think about men and women separately as an extra thing. Instead, we carefully include the need and idea of everyone in all our plan, and we need actually do the work for sanitation. This means that we make sure everything we do work well for everyone in the community. So in this point, I just want to raise one press is two head is better than one head. We have include everyone in here, so we want to know what their idea. Sometimes women know their situation better than me. So that's why we have to include everyone here. Our district committed to safety managed by 2028, I hope, because our strong commitment, we believe that we can do it better and faster. Our district have made a promise to reach higher level of good toilets for everyone by the year 2028. This means that we are not just aiming for basic toilet. We want to safely manage ones which are even better and cleaner. In this point, I just want to clarify that getting the ODF plus is difficult, but to keep people using their toilet all the time, it's much more difficult. So we have to commit it and do it every day. And for the next slide, I think it's the last slide. What we are going to do next for better toilet that we can handle climate change and for everyone here. So as our village, we surrounded by village by a river, ponds, and stuff like that. So it's easy to get flooded. So if the toilet is not resistant or resilient, when the water come, it we cannot use anymore. So this is what we are thinking to make it much better than nowadays. There are areas that we need to work on. First is climate change resilience, capacity, and resources. For inclusivity, there are most important things that we want to achieve. We want every family to have pipe drinking water directly to their house and their own toilet. You know, in a country, in about 10 years or 20 years ago, we use the water directly from the river, and now we have clean water. We just open the tap and we can use it. And for some farmer, they use the water to plant their plant also. Second, we want 100% of people in Sakanda to have toilet that are not just basic but are safely managed. The last, we want more toilet that everyone can use both at home, in the public places, and this toilet should be strong enough to handle things like flood, like what I said above. Okay, everyone, this is the end of my my talk. And as we look ahead, I want to leave you a question for thought and potential action. What innovative strategy can we explore to foster more resilient and equitable sanitation service delivery in diverse district context, including SM option? Thank you everyone for your attention. Thanks.
Thank you very much, Mr. Dina, for really inspiring presentation and then really demonstrating that strong leadership and commitment. Hearing from the actual governor how important the sanitation is, and then embedding that priority to the district plan, not only the short term, next 1 year, but also 3 and 5 years, with actual funding commitment from the district and even the lower administrative levels of the government units as well. So I really took also note of your thoughts about we cannot know, we don't know. Very important, emphasizing the importance of the data. So thank you very much. And there are lots of questions in the chat. Some of them hopefully we can address and then hear your responses later during the Q&A. But hopefully others we can start having that some responses from you and the colleagues from Cambodia. Meanwhile, I would like to then now pass the mic to Monsieur Yarga Uwe Dembele, Direction nationale de l'assainissement du Mali. Sorry, I said it in French while I was in English channel. But now we are going
merci
to
beaucoup
hear.
et bonjour à tous.
Thank you very much. Hi, everyone. Like you said, so thank you, everyone. Like you said, I'm Nyarga Ule Dambele, the National Sanitation Directorate and the Control of Pollution and Nuisances in Mali. And I'm going to share with you our perception about the rural sanitation types. So we're going to build on enhancing the thematic of rural sanitation in Mali, because in Mali, rural sanitation is characterized by a lack or insufficient infrastructures, a lack of eco-citizen behaviors, as well as by financial constraints. And all these aspects together actually highlights the low level of access to sanitation. And to basic, we have a basic sanitation access level of 50%, including 60% urban and rural 42%. Regarding safely managed sanitation, we have a rate of 16%, including 20% at rural setting and 8% in urban setting. We have a rate of open defecation of 5%, including 1% in urban, 7% rural. This is the general context in communities. So I've actually used a specific case in schools where we have 30% access to basic sanitation. And all these show that the major challenge in the sanitation subsector is the underfunding of the sanitation subsector. In 2014, during an international SWA international session, Mali committed to commit 5% of its budget to water and sanitation. But following the recent evaluations, we have a rate of 3.52% against the 55% announced. So the progress so far in the area of rural sanitation towards safely managed sanitation, actually we said that we need to actually equip ourselves by having approaches and tools that would allow us to achieve a safely managed sanitation or sustainable sanitation. And for that, we went through the review of our national sanitation strategy, which includes 5 national programs, including the national program on the sustainable management of wastewater and excreta. Also, on the aspects regarding the reduction of inequalities in line with SDG 6, we're not left behind because we included the principle of equity in our sanitation policy. And on the national sustainable management of wastewater and excreta, thanks to the support of our major partner, which is UNICEF, we have a national initiative for an ODF Mali and sustainable sanitation. And this strategy has as main objective to reach safely managed sanitation. Because in the strategy, we have sanitation marketing, and we have put an emphasis on safely managed sanitation. And climate change has also been taken into consideration because we are all exposed to climate change effects. So under this, we have an approach that wants us to be resilient to climate change. So this strategy includes resilience strategy, sanitation with a specific focus on our resilience. So this, as part of this, we have developed sanitation marketing, and in Mali it was on 3 regions. And let's note that this approach has seen progress on the field because, like we said, this is an approach including operators, masons, promoters, as well as customers. So this is an approach that was successful at the local level and which led all these communities to have sanitation facilities that meet SDGs, which led us to reach safely managed sanitation status. But how did the communities take ownership of the approach? We have used communication channels, sports, and radio and television programs. And all these allowed us to achieve the following results. First, to understand, let's note that the project had two key phases. Key phases. So between 2014 and 2024, there were two phases. The first phase was between 2014 and 2017, and the second phase between 2017 and 2022, but it's still continuing. And this actually allowed us to create a network of 170 private operators, in addition to 350 sanitation promoters who have been established and who are functioning without any support. In addition, we've been able to build about 30,000 plus latrines, amounting to more than 3 billion CFA, about 6 million USD. And the results of these projects have led to a sustainable behavior in the communities. And communities are still selling their products that were adopted, disseminated during the phase 2 of the project. So the project was really able to achieve its results, because when a project starts, even when it ends, the good achievements need to continue. And this is what we try to have in the approach which we call sanitation marketing. And to maintain this, we have put in place committees in each region. So we have regional committees at the regional level, and all these committees were piloted by a national committee for the monitoring and supervision of the projects. Now, regarding the challenges and perspectives, we have number one, the satisfaction of the national demands in products, because the success of the project has led to demand from all the surrounding communities who want to have this type of latrine. And they included the Satopan slabs. So we want to make sure that by 2030, we maintain this to allow all the communities to have access to this type of slab, and with the possible introduction of Sato products that would allow the scale up of this design of latrine that are in line with safely managed sanitation. Number two, we have fundraising to support the implementation or scale up of the safely managed sanitation markets in a rural setting in Mali. Slide, please. So our recommendations, given the fact that this approach has proven to achieve results, we want to develop a funding mechanism to accelerate access to sanitation, including for vulnerable and hard-to-reach households, because we cannot say that we have achieved safely managed sanitation and SDG until we solve disparities. So we need to think about vulnerable people as well as those who are in remote areas and hard to reach area, for them also to have access to sanitation. And we also need to integrate the systematic use of SATO products, because these are products of market-based sanitation. They are built by local masons through the implication of the promoters, national local promoters, and we need to integrate them systematically in the norms and standards of construction and public latrine facilities in schools and healthcare facilities. And we have a reference healthcare facilities in one of our circles where all the latrines of the centers are equipped with SATO products, and this results has really drawn the attention of everyone, and we need to maintain good results. Thank you very much. This was the Mali experience, which I had the honor to.
Thank you very much for a very concise but practical presentation on the experience in Mali. I really take the common emphasized priorities coming from the example of Mali and also Cambodia, emphasizing the importance of universal access, including the inclusiveness of the sanitation services, that it has to be available for everybody. And not only at the household level, but in order to achieve universal access, we need to also address the issue of lack of or limited availability of access at school and healthcare facility settings. So with that, we have about 5-6 minutes for question and answer. We've seen quite a few questions already in the chat. So I'd like to hand over to my colleague Andres José Gonzalez to moderate that question and answer session. Over to you, Andres.
Thanks, Maya, and thanks to the presenters and everyone for making my job very difficult by putting lots of questions. I've tried to summarize now for Mr. Dinacheng. There are 3 clusters of questions. One is around the subsidization, and I think this is an important topic because it has been a bit of a taboo in the past. How do we support lower income households in rural areas? So I think if you could give us some details in what shape did that support take to households? Was it like in kind or with cash or a bit of everything? How did you identify those low income households? And then did you see that there was behavior change? Because often when toilets are subsidized, we see that people don't use them or don't value them. So how did that behavior change component work? That's one set of questions. And then the others are around financing. How do you get donors and partners to support? In the past, how have you done it? How will you do it for SMS? What are the challenges? And then maybe if you can respond to those 2, and the third one we will keep for the chat, or if you are very quick responding those ones, I will add another one. Please, over to you.
Hi, Andre. Sorry, everyone. Mr. Dinacheng, he's currently in another meeting. He's went out already, but I have also discussed with him and also provide answer related to all the question to Mr. Dina. So I will summary all his answer and put in the chat box. Thank you.
Yeah. Do you want me to repeat the question or?
No, I already read the question in the chat box already. Yep.
So do you want to speak to any of those questions briefly?
I think I will discuss with Mr. Dina and also
Okay.
put in the chat box as some answer. I need to ask him as well. But
Sure.
I apologize, he's run quickly to another meeting. Thank you.
Yeah. That's fine. So we will try to add them to chat box, or when we send the email with the recording, we can respond to some of those. I will move them to Monsieur Dembele. So there's one question about the cost. So around the cost seems to be, based on your figures, around $200 per latrine. Can you clarify which types of latrines are you building in Mali as part of your program? And then there's another question around the roles of the regulators in achieving ODF in your communities. And then how do you maintain community engagement? So let's start with those three, if you want to react to those. Thank you. Yes. Okay. First question is about the type of latrines that are being built as part of the program in Mali. Then one question around what is the role of the regulators, and another one about the role of the private operators, and finally, how does the project maintain community engagement to sustain open defecation-free status?
Yes, I got the questions right. So the first question was on the type of latrines that have been built as part of the program in Mali. So I will start with this question. We have built improved latrines as part of the program. How is it that we have been able to do that? It's about segmentation. We put the stress on the villages that have put an end to open air defecation. These villages have built latrines, but the materials were not sustainable. The material that have been used were not sustainable. So we had to help them to sustain their structures. So we tried to facilitate access to input for that reason, for that purpose. Within the community, we try to identify a trader, any trader who can sell these materials. And if we find one, we can help that operator, that provider. And then we have trained masons, local masons, that have been taken for the construction of these latrines. And the communities have embraced the program. We set up a kind of a promotion program. So when the promoter facilitates the purchase of an equipment, the promoter is given 2,000 CFA francs as a bonus. If you are able to convince the traders to sell more materials, the more materials they sell, more money they'll be making. That is how we actually got everybody to embrace the program. Now, when it comes to the use of toilets, it should be said that we are involved in the sanitation-led, community-led sanitation. with the support of our main partner, which is UNICEF. 5 years ago, we made an experiment in a federal village within the same municipality. We had one federal village and one non-federal village, and we asked to get the statistics of the disease cases in the federal village and disease cases in the non-federal village. And we found that the fact of having an improved latrine and maintain it contributes to keeping the community healthy. So when a community uses the latrines and a community doesn't use it, we can see the difference. It's on that fact that we went to convince the other communities to embrace this behavior change when it comes to sanitation. I hope I have answered your question. Thank you. This is well noted. Thank you very much. We will see whether there are questions that are addressed to you that have not been answered. We will identify them and send them by email to you at the end of this webinar.
Great. So thank you everyone for the questions. I'm now handing over to Martina Rama, who is our specialist at UNICEF, for some remarks. Thank you. And maybe let's, swap the view. Perfect.
Hello, everyone. It's a pleasure to be here. Can you hear me all right? Great, thank you. So thank you very much to all our speakers. It was very interesting to see all these examples, especially from Cambodia and Mali, and have all these interesting insights. Some final remarks of our webinar that has been very interesting that come with the wrap up. So I think the main takeaway of the sessions are three. The first of all is that basic sanitation is just a starting point. So as we can see, all these examples, they started from working on ODF for demand creation. But this is just like the starting point on which we have to build to move up the sanitation ladder towards a safely managed sanitation. And most importantly, the area-wide approach with strong involvement of the local authorities to really embed this program in the national context is very, very important to move up the sanitation ladder towards a safely managed and climate resilient sanitation. We also need to think about scaling up rural sanitation. And to do this, we need to have a context-based approach to see specific solutions, to have a variety of different technical solutions to fit all the different situations, for example, in the flooding areas, in the dry areas, and also the different type of users and the user preferences. And also a very important inclusive approach, as was very correctly mentioned, to see at elderly people, children, people with disabilities. So a variety of technological options is needed, and a market-based sanitation approach, marketing-based, is very important to have all these different sanitation approaches and to strengthen the supply chains to enable access to all these different technologies. And the third point is really the centrality and the importance of local governments and really empowering this local governments. As it was mentioned in many cases, local governments sometimes are weak, they lack capacity, they lack financing. So it's really important to support local governments and put them in the driver's seat for them to be able to plan, as it was correctly mentioned in the Cambodia example and also Malian example, to plan for this area approach and also to budget for this area approach in order to ensure really sustainability of the approaches after the end of the project. Also, policy and regulation is important to adapt regulation and make sure that the whole service chain is taken into account, not only the sanitation infrastructure, but also safely managed sanitation in terms of fecal sludge management and all the different steps in the chain, which need to be all linked together in order to have the required health benefits. So I think these are like the main intakes, and an additional point that was very much mentioned was really the need to have an inclusive approach and for the equality and to reach hard to reach people, households, vulnerable households, with also smart subsidy approach for targeting those specific households. So thank you very much, and over to you, Maya, for the final closing. Thank you.
Thank you very much, Martina. And also thank you very much, everybody, for joining this session and having the very active interactions and then questions. We will definitely get back to you with some of the questions not yet answered. But also I'd like to say that there are 2 more sessions on the topic of urban settings and also strengthening HR capacity session and the last one remaining. So please join this journey of peer learning for the rest of the 2 sessions. And once again, thank you very much for all the speakers and the presenters for really insightful experience shared. I wish you all have a good rest of the day. Goodbye.